Hey, everybody. I hope you guys are all doing great. This is your Mind Your podcast with yours truly, Dr. Connie. Today, I want to talk to you guys about the problems with autoimmunity. As you know, I've lived with an autoimmune condition for over 22 years, and I've had best of the best doctors taking care of me. But also, there are some statistics that I want you to be aware of because what I learned is that every single one of the autoimmune patients, we tend to focus on our own autoimmunity. But in the spectrum of the whole autoimmune disease, I just want to take the time to refresh your knowledge about autoimmunity. That there are 80 different autoimmune diseases today. And according to the NIH, autoimmune diseases affect more than 24 million people in the United States. But an additional 8 million people have autoantibodies, which indicate a person's chance of developing autoimmune disease. And the American Autoimmune Related Diseases Association estimates that number is close to 50 million Americans, citing incomplete data contributing to the NIH estimate. So, what exactly is the cause of autoimmunity? Because what I realized was, even myself, I stopped thinking about the cause of autoimmunity because there's so many things leading to autoimmunity, but not a specific answer. And so, the answer is a shoulder shrug. But there are many triggers for autoimmune disease, including stress, diet, lack of exercise, insufficient sleep, and smoking. Anything that causes chronic inflammation in the body can eventually lead to the development of an autoimmune disease, which could be one that they're becoming increasingly, or which could be the one reason why they're becoming increasingly common for even those who are not diagnosed yet, because there's a heck of a lot of people with symptoms of autoimmunity, but they haven't been diagnosed. So according to their labs, they're spick and span because everything is normal. And it's sort of like doctors wait until they are completely out of whack before they intervene to do anything. And studies indicate these diseases likely result from interactions between genetic and environmental factors. Gender, race, and ethnicity characteristics are linked to likelihood of developing an autoimmune disease. And that stress is the number one factor in triggering autoimmunity, and stress is fight or flight, which is a sympathetic response of the autonomic nervous system. Okay? So in essence, the problem with autoimmunity is that autoimmune diseases are notorious for being difficult to identify. And many patients suffer for years without a medical diagnosis, including myself. And I know many of you guys would give a hands up to that. And the truth is that the immune system is so complex, we haven't even begun to fully understand it. And in my 22 years as an autoimmune patient, I've had lots of amazing doctors. And while they were skilled in their specialty, there were lots of times where they were too puzzled by the unexplainable or intractable symptoms that I was exhibiting. And when they can't understand it or name it, they throw medications to try to mask the symptoms. And the only thing that it does is to damage our body and really irreversibly affect some biochemical response within our body that might turn on certain genes while shutting off some genes. We don't know what's happening, right? So I've learned to discern what's right for me by following my intuition when it comes to what I should do for my autoimmunity versus wholeheartedly trusting somebody else to know exactly what's best for me. Most of you have the following symptoms that come and go if you have autoimmunity, and they include fatigue, pain, rash, sometimes anemia, or leukopenia, which is decreasing white blood cells, which limit functional ability, decline, and then this declining functional ability robs you of your livelihood, affecting your income because you can't go to work, you can't build your career or improve your relationship. And due to stress from all of these, your health is affected, right? Leading to stress, affecting your autonomic nervous system. And why that's important is that inflammation is considered the ultimate trigger for autoimmunity. So let's discuss what exactly is inflammation. Well, it's when the immune system reacts to a clear or reacts within the body to clear the body of whatever it is that causes the disease in the body. Okay. And stress is the root cause of autoimmunity as well as other common chronic illnesses. So how does stress affect the body? Well, autonomic nervous system has two different divisions. One is sympathetic, which is fight or flight, run for your life kind of scenario, and the parasympathetic, which is more the calm, zen, let's regenerate and heal kind of a division. But the problem is for most autoimmune patients, sympathetic response is up leveled, right? It's really it's really on high drive with sympathetic, because sympathetic is when the body thinks you're in danger. It releases highly inflammatory hormones and chemicals in the body to enable you to be able to flee when you need to. And the problem is that it's not a sustainable state of being. With increased cortisol levels, not only does this cause weight gain, but brain fog, anxiety, depression, pain, insomnia, and even more pain, right? So at the end of the day, we need balance. And the other thing to understand is the phases of autoimmunity. Nobody really tells you about the phases. It's not like a phase of being sick and well, but there's the 4 essential phases of autoimmunity. And I've personally added one more phase to that, and that's the phase that we should all strive to get to. So I'll explain. But the first phase is usually the symptoms phase, where things are happening to where you're enduring various symptoms that keep you from living your life. This is a highly volatile phase where we're given all kinds of meds to try to mask and control the symptoms, but it's going like you're going crazy and the doctors are curious and really concerned with all the symptoms, but they don't know what exactly to do about it. And most of us think, oh my goodness, we fear for our lives because we think it's a deadly disease. We just don't know what it is, right? And then the second phase is when we approach the diagnosis phase. This is where we learn to get a grip on the symptoms and know what we're dealing with. And when we do know, when the mind knows what it is, it sort of takes a deep breath, right? We're given definitive medications as we enter the stable phase. And after a while, for whatever reason, that we run into a volatile phase again, the third phase called the autoimmune flare. And this is where we don't know the trigger, but somehow our immune system is activated again to cause all kinds of symptoms. Sometimes there's organ damage, and sometimes it's a minor ache and pains that we're dealing with. And then the fourth stage is when we enter the remission phase, where it's stable again. Things are calm before the storm, but we all know the storm will come despite our hope that things stay calm forever. So I want you to understand that after the symptoms and diagnostic phase, those phases only happen once. And as we enter sort of the autoimmune flare stage or phase into the remission, that's where the loop of continuity is with autoimmunity. We go from autoimmune flare into remission forever and ever for some of us. And then we enter into an autoimmune flare only to come back to remission phase again, right? And that's sort of the hamster wheel is something that I'm trying to get most of you out of, into more of the vitality and health phase, where you can be all about being healthy, not despite autoimmunity, but because of it, right? Getting stronger than our own bodies and our minds. Okay. And in essence, in a nutshell, this is the situation with autoimmunity. I used to believe in my prolonged remission, that I finally turned my autoimmunity around. It was finally under my control. I know what to eat. I know how to control my diet, almost to a point where it used to get to my head about my ego, and I didn't understand why some people were struggling with autoimmunity. I really thought and believed that I was free from limitations of it. After 8 years of nothing, no medications, no antibodies, of course you're going to think I'm healed forever, right? But circumstances in life are things we can't control. For me, it was COVID. This threw everything out of control, and my immune system was on fire for a while, where even the most potent medications were ineffective. And let me remind you, at first we were told, get the vaccination. Once you get the vaccination, you can't get infected, right? Now we know that that is the furthest thing from the truth, because I know that after my vaccination, I was tested for the antibodies and it was negative. Somehow or another, when I did experience a flare, another doctor checked for my antibodies again, and it was positive, highly positive, and it's been positive ever since, which tells the story that I was infected even despite my vaccination. But the trouble is, I didn't know if it was the COVID or my autoimmune flare, because I was sick for a long time with my flare. It is for this reason that I take a very different approach with autoimmunity. I don't believe in the surface level, holistic, or conventional methods, such as changing to a specific diet, taking specific supplements, medications, treatments, etc. I believe that the healing, the real healing, is only possible with mind-body alignment in order to regain long-term vitality and health. And the goal should be much grander than feeling better or to get rid of symptoms. Those are just like minor things that we all want with autoimmunity, but I want you to think bigger than that. Because your life should focus on living the best possible life because of autoimmunity, by thriving. So I believe highly in self-empowerment, self-inspiration, motivation, and again, mind-body alignment that allows you to rise up against adversity and tackle your problems with courage and faith. This is what is required of you. So are you ready? Because I'm hosting a 7-day alkaline detox challenge for autoimmunity, where I teach you how to regain control over your diet by thinking about eating in a whole different way. I redefine health, what it means to be healthy for you, so that you can live and enjoy optimal and vibrant life forever, going forward, without being limited by autoimmunity. I actually want you to be free from the limits of autoimmunity. I don't believe that we have to live in limitations and negativity because of autoimmunity, which a lot of the cases, in the name of good health, most of even the holistic options for autoimmunity is severely limiting. We're always told to avoid this, avoid that, don't eat this, don't eat that. It's never a life of freedom. It's always about, because you have autoimmunity, you must do this. But I believe it's time for us to listen to our own bodies, understanding that there are many variables with autoimmunity. Those variables are only controlled by us, and really healing is an inside job. It can only happen from the inside out. And 22 years as being the master of my own health with autoimmunity, I know that to be the truth. Okay, so please join me. Click the link below. It's going to happen in a couple of weeks. So please, please, please join me, and I will see you guys all then. Enjoy your health and vitality, you guys, and I'll see you guys soon. Bye for now.